Welcome to BFM's Health and Living webinar. It's the 7th in our Health and Living webinar series that has been running since April. And sadly, we're near the end. Our last webinar will be next month in November. But, we've been keeping this going and keeping you informed and educated. And of course, for the series, we really have to thank our presenting sponsor, AIA Berhad. Now, if you have been following our webinars every month, you'll know that we have a lucky draw. And of course, this is all leading up to one grand prize at the end of it all, which is a Samsung Galaxy Watch Active 2 worth 999 ringgit, courtesy of AIA Vitality. So of course, for this webinar, we have a lucky draw again. We will need you to watch the full webinar, of course. And at the end of it, you can click on the link in the comment section to download. For this month, we have a diabetes diary, and you will be in the running to win a Samsung Galaxy Fit 2 courtesy of AIA Vitality. So for last month's webinar, we do have the winner to announce, and the winner is Chin So Ching. The winner for last month's webinar is Chin So Ching. Congratulations. Thank you so much for joining. And BFM's events team will be in touch to arrange the logistics with you. Now, we also have a bonus for everyone watching. We're hosting a live Kahoot quiz at the end of this webinar for you to win other prizes on top of the lucky draw. So do stay with us all the way to the end in order to participate in that quiz. And today we'll be talking about diabetes, something that we're all very familiar with because almost 1 in 5 Malaysians has diabetes. And that means we're talking about an average household, really. And it's most likely you and me. We will have at least a family member or two who has diabetes. Now, if that's you in that situation or your loved ones, are you also having trouble managing the condition? I know a lot of the advice that's given is easier said than done. And do you also think that is it possible to reverse diabetes? we have our experts here to tell us whether that is possible, to give us the answers, and also to give some advice to help you stay motivated in managing your diabetes. And our speakers today are Datuk Dr. Zanariah Hussein, a consultant endocrinologist from Hospital Putrajaya. Hi, Dr. Zanariah. How are you today?
I'm fine, thank you. So nice to be here with you, all of you.
Yes, and our other speaker is Mageswary Lapchmanan, dietitian and deputy director from the Allied Health Sciences Division in the Ministry of Health. Hi, Mages. How are you?
Hi, fine, thank you. Nice to meet Dato' Zanariah after such a long time, and also you, Xiao Yi.
Wonderful.
Yes, so do pop your questions for both our guests in the comment section. Starting right now, we'll be trying to address them throughout the webinar as well. I'm sure there are a lot of questions from people who are perhaps having trouble managing their targets, trying to figure out what they need to do if they've hit a block, which I think can be very common for people living with diabetes. But Dato' Zanaria, I've heard that when a person is diagnosed with diabetes, they may have already had it for 6 to 8 years before that point. Is that true?
Yes, that's very true. I think diabetes, as well as hypertension, it's known from before as what we call a silent killer.
We appear to have lost Dr. Zanaria for a little bit. Dr. Zanaria, if you can hear me, perhaps. Okay. It's all right. I'll try to get. We'll be trying to get Dr. Zanaria back on. But Magis, perhaps I could pose that similar question to you as well. When patients come to you, if they've been referred from their endocrinologist or physician, at what point do they usually come to see you, and what kind of complications may they already be facing from diabetes at that point?
Okay, usually as a dietitian, we get referral from the doctors upon diagnosis actually. And of course, as we know, that the diagnosis point doesn't mean the start of the disease itself. It could have happened like 5, 6 years ago, and I'm diagnosed, and most probably the person themselves never experienced any symptom of diabetes. That's why they are being quiet and not getting the treatment. So usually, the treatment seeked when they have symptoms. So when
Mhm.
they are referred to us, they come with symptoms of diabetes, and that's where we try to give the medical nutrition therapy. I think that
Yeah.
though Zanara is back, she could,
Sorry,
yeah.
I was a problem with connection just now. Yeah,
Yes.
so you very often, when you're diagnosed with diabetes nowadays, because we're encouraging people to be screened, yeah, so they're not having symptoms at presentation, and that's the best way to be diagnosed with diabetes, actually early without symptoms. But it's quite hard to place when you actually develop the disease. But if adults are going for regular screening, in fact, they'll realize that, as time goes by, maybe year after year, you might see some differences in your fasting glucose, and you can sort of see when it is that you actually, cross that fence, from pre-diabetes to diabetes. But if you are doing so, I think you'll be cautioned to actually take care of yourself better, and try to keep the numbers the same, or even go down, and backwards from that eventual progression from pre-diabetes to diabetes. So that's what
Mhm.
we hope can do for everyone. Yeah.
Yeah, but what are you finding when by the time that they come to you, have they been good at doing the regular screening and are able to come to you early, or are they coming to you with kidney failure already at that point?
Okay. So in Malaysia, diabetes, managed by largely by primary care or in community care. So I work in the hospital as a diabetes specialist or endocrinologist. So we get to see usually patients with longer duration of disease. We're referred from the GPs or primary care. So we get the more difficult, complex cases, the one of long duration on a lot of medications, and sometimes on injections, or most of the time on injections as well. So they do usually have problems by the time they come to see a hospital based doctor for their diabetes care. But in community setting, I think there's a very good chance that you may have early disease. And at that point in time, if you tackle it properly, there is a possibility of maintaining good control, or even sometimes doing so well that you may, what they call it, revert it a bit, whatever term you want to use. Yeah.
Well, that's a big question these days. A lot of people are talking about curing diabetes. Is it
Yeah.
possible?
Well, cure is a bit, it's a short word, but it has a lot of meaning there. And cure usually means that you get rid of the disease and it doesn't come back. So that's a bit difficult with diabetes. But what can happen is, sometimes we use the word reversal, and the other word that we use is remission. So when that happens, there is a possibility you can sustain that, state of going back to normal, but there's also the possibility of coming back into diabetes if you don't take care. So you can actually get, if you talk about cancer, you're talking about remission and relapse, so you can relapse back or bounce back into diabetes if you don't maintain those, whatever that is that helped you get, to normal. Yeah.
But what does normal look like then? That means your blood glucose is back to its in so-called healthy levels. But does that mean you can get off medications, insulin even?
Yeah. So there is a proper definition for reversing diabetes. That means that you're able to achieve what we call HbA1c, which is a blood test which reflects the average glucose, that your sugars are no more in the diabetes range, but in fact it might be in the pre-diabetes range. Yeah, and you are off, totally off all your medications for at least a few months. Some would say 3 months. So if you're off your medications and your sugar patterns are not in diabetes range for that duration of time, then you would have achieved what they call reversal or remission. And this is what they target for when they're looking at clinical trials. If they do certain interventions, whether it's diet or whether it's even surgery, bariatric surgery, how you define remission. Yeah.
And Mages, from the perspective of your daily lifestyle habits, right? Looking beyond the clinical management of diabetes, if we're talking about reversing diabetes, what does that mean for the person in terms of their eating, their lifestyle habits? What can they do? Can they go back to letting it all out again?
Uh, I guess this is just temporary remission, or you are reverting your sugar level or symptoms. So, having been a pre-diabetes or diagnosed with diabetes, you're always in that zone that you have to be very careful of. With weight reduction, they'll be able to see some good control of the glucose. At any time, the continuous taking care of your lifestyle, diet intake, and also exercise has to be continued. You cannot just forget about it and freely eat whatever you want, which it will get you back to the condition again.
Mm.
So it's not like 100% solution, but careful intake of the diet and modification of the lifestyle has to be lifelong. I can say it's lifelong.
I
Yeah.
think that may be the bad news. People never want to hear that, right? That they have to control their diet. And you talked about that you can't just freely eat anything you want.
Yeah. Maybe
Now,
I won't want to use the word control. I think nobody like to be controlled. In simply put, I think it's more of modifying the way that you eat, the food choices that you have, and also the modification of the lifestyle. Actually,
so
more of that.
on that note, we were running a Twitter poll asking
Yep.
people, if they think it's true that when you have diabetes, you cannot eat rice for the rest of your lives. Almost 11% think that that is true. And the similar myth came up on our Instagram question as well. Must you
Mhm.
avoid carbohydrates or carbs when you have diabetes? Can you address that, Magis? Rice and carbs.
Yeah, I think this myth has been there for a long, long time. and that is not true actually. In a human's diet, as a person, you need some amount of carbohydrate. If you are a diabetic or non-diabetic, you have to have the carbohydrate portion. That's the healthy portion actually. So which should be like, maybe if you know your calories, should be like 50% of your calories should come from carbohydrate. But in diabetes, actually, what type of carbohydrate you are taking and the amount that you are taking, that's more important. When it comes to the type of carbohydrate, because we are looking at the complex carbohydrate, so you have to have your fiber in your carbohydrate, and you have to have a whole grain type of how to say, the selection. That is why usually you are advised to take more of brown rice or wholemeal bread, oats, which the good type of carbohydrate you are taking, rather than taking like white rice or simple carbohydrate, or maybe sweet drinks. It's also carbohydrate. So the take home message in this will be, when it comes to carbohydrate, you can have your carbohydrate, take care of your type, and also in terms of the amount that you take, and also what you take in your meals. Because we eat like 3 or 4 times a day, you have to spread out the carbohydrate throughout the day. So you don't eat like banana leaf, one mountain full of rice for lunch, and you try to control your breakfast or dinner. It has to be distributed throughout. So it's very wrong to say that you can't take carbohydrate or even rice for being a diabetes.
So I think we need a shift in our Malaysian diet. So perhaps
Yeah.
nasi lemak and banana leaf rice with a lot less rice, kurang the nasi, and
But of
wholemeal rice
course,
on top of that.
yeah,
Sorry,
why not?
brown rice on top of that. I
In
don't know if
fact,
Malaysians will be happy
yeah.
with this.
In fact, you see restaurants. I mean, if you have you go to the maybe high end restaurants, do you have choices like they have served brown rice, and also they have wholemeal bread, sandwiches, and things like that. Even if you go to normal mama shop, they have two type of rice. I could see now, the right white rice and also parboiled rice. So it's your choice. Or maybe on top of that, they have a biryani rice. So it's the person's choice what you want to
Yeah.
have.
Yeah. And Datuk Zanaria, we have a question from Judy, who's asking, will we have to take our diabetes medications long term? Can we stop it if we control only our diet and exercise? And I'm going to add to Judy's question, weight as well, Dr. Zanaria.
Yeah, so Judy, and it's the results of studies, what we have. So in the recent years, we know that it is weight loss that really determines whether you can actually take off your medications, and in fact whether you can even reverse diabetes. And it has to be a large amount of weight loss and a sustained weight loss. And the weight loss we mean is something in the a range of, say, a 15 kilo weight loss, or you know about 15% weight loss from where you started off. If you're able to do that, and most of the time you're in an overweight or obese condition, then you can actually definitely start to see that your glucose gets better, and you may be able to slowly, with the advice of your doctor, of course, get down on the doses of medications, and sometimes the number. A lot of diabetics are on maybe two, three, or sometimes four medicines, oral, sometimes insulin. And with the weight loss, what happens is your insulin that you already have in your body starts to work even better. And because you're losing weight, you're moving better, you're very active, and that even makes the insulin work even better. So you're going to find that you may not need those medicines. And in certain circumstances, we could guide you to be off your medicine. So, you really have to work together with your diabetes care team. And it's about, as mentioned, cutting the carbs and then losing the weight, maintaining that good weight off, and the success story of, slowly taking the medicines down and maybe off. Maybe is
Yeah.
the.
Of course, and the weight loss, it's going to give you that extra push, isn't it?
Yeah,
But
yeah.
15%, is there a time frame? Do you have to lose it within the first 3 to 6 months, that kind of thing?
Yeah. Well, with whatever sort of way you lose weight, and often we refer to diets and sometimes uh, medication specifically to lose weight, which are not very many in the market and available and accessible. It's usually what you target is about 6 months, realistically that you lose about 5 to 10% of your body weight, and then subsequently a little bit more, because there's a tendency to plateau after the first few months of a rapid weight loss, whatever you do. So it's um, not so rapid, a gradual and maintained weight loss. Yeah, yeah, that would be the
Mages,
best.
what will make the difference in terms of achieving and sustaining that weight loss? Is it the diet part or is it exercise?
I think there are many components involved. Definitely, the diet you have to take care. The input and output has to be balanced actually. So the intake of the food, the amount, and also the calories has to be taken care. And of course, the exercise is important for us to maintain the weight loss that we have already achieved. Maybe it looks like 10-15% looks very huge, but if you really look at a person with 80 kilos, let's say, if they were to lose 10% of their weight, it's only like 8 kilos. Or 5% is only 4 kilos, which we are looking at in a half a year. That's a very long, long time actually. So if they could reduce their weight in a week, half a kilo is like 500 grams, is like one small mineral water size of weight that we are losing. If you can sustain the weight loss for 6 months, I'm sure the target that we are looking at for 10 to 15% is very much achievable. But only thing, they have to maintain the weight loss thereafter. If you are doing the yo-yo kind of diet, reduce, go up, and you don't see a net difference. So that's very important in the sense of losing weight. And also sustainability is very, very important. And they have to maintain their diet type and also the exercises throughout. And it has to be part and parcel of their lifestyle actually.
So that's where the challenge is going to come in, isn't it, Dr. Zanaria? We're talking about
Yeah.
years, perhaps, after 5 years,
Mm,
or maybe even less, that initial urge, that adrenaline rush to
yeah.
get things right has probably worn off. What do you find?
Yeah. What I know is you can't do it alone. You know,
Yeah.
it's bound to fail if you do it alone. So what has been shown, again, we always go back to evidence, clinical evidence from trials, is that you need support. You need guided dietary advice, professional guided dietary advice, and then you need someone that checks on you. You need to adhere to that program of so-called intensive lifestyle, because it can't just be the lifestyle, just a small change in the lifestyle. It has to be an intensive change in the lifestyle. It needs guidance and it needs mentoring, it needs coaching. So that is, I think, what is missing in most circumstances, and that could be the key to actually getting people to be able to be successful if they have that guidance along the way.
Mm. And do we have a practice of people doing that, Magis, that they check in with their dietitian perhaps once every 6 months or once a year to sort of see what they can modify, or are people just terrified of seeing a dietitian?
Okay, I think we have maybe two or three types of persons with diabetes. There are who are very stringent and they ensure that their diet intake is being checked. In fact, now we have a lot of apps actually. You can just key in what type of food you eat and how much you are eating. The app will be able to tell you how much calories, protein, in fact, how much of the sugar that you are taking. So if they know the how much of the amount of calories needed, let's say 1,800, they'll be able to do a check and balance on their diet actually. So we have people like that. In fact, some they do the self monitoring of their glucose frequently to ensure that the meal amount that they're taking is appropriate for the medication or insulin. So we have that kind of type of people who are really really careful about their diet and ensure that glucose is being controlled. And the other side, we also have people are just putting that, how to say, they always put back the responsibility on the healthcare providers like us. They feel like every time I see a dietitian, the dietitian will be able to do some magic to get things controlled. I think over here, what is important, the self empowerment, because the care should come within from the patient or the customer or client actually. So
All
I
right.
think if they can internalize that, the control will be able to sustain, and also the sugar control will be good.
We do want that magic pill, don't we? Um, Dr.
Yeah.
Zanaria, we have a question here from Joshua who wants to just find out more a bit about, what we were talking about, weight loss. Joshua is asking, is it weight loss or fat loss that's important?
All right. So, in most circumstances, Joshua, if you do lose weight in a big way, a big part of it is going to be fat loss. Yeah, but also a part of it is, unfortunately, also probably some muscle loss as well. So that's something that's going to be difficult for us to assess just by looking at the scales. About how many kilos you've lost and how much is fat, how much is lean mass. This is only known if you actually do research and you can actually quantify it, because we don't want to lose too much muscle, isn't it, Magis?
Yeah.
Because that's important. Muscle mass is important so that your insulin can work well. So if you have too much loss of muscle, you also are in a state where your insulin can't work so well. Yeah. So yeah. So that would be my
Yeah.
answer. Yeah.
And then Joshua's add-on question, perhaps Margis, you can address. For someone who is into a lot of weightlifting and building of muscles, what kind of advice would be suitable so that they are not losing muscle?
Okay. I think whatever Joshua is adding on, weightlifting, muscle building, and all that is has to be part of the exercise regime that a person should have. Rather than cardio alone, they also should have the resistant exercise, which they have to maintain, also build some muscle. So as we mentioned, whenever you reduce your calories, you're going to lose your fat as well as your muscles. So when you do these resistant exercises, we will be able to maintain your muscle and also accelerate the fat loss. That how it should be. So in terms of the diet change when you're exercising in such a manner, of course the amount of protein has to be lifted a bit more, but it's not tons of protein. Maybe another 5-10 grams of additional protein that you need. And throughout, of course, the carbohydrate portion that I mentioned has to be kept within 50%. And the workout has to be done accordingly. If, let's say, a person there is a tendency to have hypoglycemia of their own very high level of insulin regime, I'm sure Dr. Zanariah will agree, then they have to be personalized diet therapy given to them, and also they must go back to the doctors and dietitian to monitor and see how the exercise regime works with their diet without having other symptoms of hypoglycemia on others. So that's very important being a diabetic.
Now, we've been talking about self-empowerment. Our questions are coming in from people who are really showing that they are invested, they want to know more, and they are concerned about what they can do. Even if you're talking about apps that help you monitor what you eat. Now, all of that is all very well and fine when you are empowered, when you are interested. Dr. Zanaria, what about people with diabetes who really just can't be bothered? And you hear of their family members trying so hard, nagging them, forcing them, and all that. How do you
Yeah.
address those?
Yeah, so it's really important from the time you're diagnosed that we invest in what we call good patient education. So we do have what we call diabetes educators. In fact, all of the diabetes care team the dietitian, the doctor, the pharmacist, and the nurse educator. Our aim is actually to make the patient more aware of the disease,
Mm.
assess the motivation level, the readiness to, impact on change in their lifestyle, and to keep motivating that, and because that is so important. Of course, there's always those that you can't help, but you keep on trying, and there are ways to actually approach them. Sometimes in the consultation room, you don't have time. You have a short time, and you really need to listen to people because they're from different backgrounds and different challenges. Managing their diabetes, and I think once you start doing that, I think the person in front of you will start to actually then be able to interact and be an active member of his own care, because actually the patient is the main person in the care team. He
Yes,
decides
exactly.
which way and which direction he'll go. So to
Mm,
convince that individual, that is the way, and that has to be
yeah.
done as early as possible once you've been diagnosed with diabetes. And once you get a person who knows that, that would be such a wonderful interaction to have.
Mages, we have two
Yeah.
questions related to diet. Ainas
Mm.
is asking about what a therapeutic diet for diabetes looks like. And
Mm.
Farah Diana is asking about whether keto diets are suitable. Perhaps we can address the therapeutic diet first.
Okay. In actual sense, actually, the diabetic diet is similar to what every other person is eating. It's only thing we have to make sure that it's within the amount that is recommended for them, within the calorie amount, and it also depending on your weight status, because as we know, Dr. Zanera, patient do come with overweight, obese. There are people with the normal weight. There are people coming with being underweight. So the individualized diet is important here actually. So if let's say we are thinking of what the diet component should look like, it has to be some amount of rice or chapati or bread, and at the same time your vegetables has to be extra, at least two portions of vegetable, meaning that you can have like in your, if you are measuring in a cup or in a spoon, like at one portion has to have at least like 3 or 4 tablespoon amount of vegetables, and at the same time your protein amount has to be there. But we are very careful about having simple sugar or sweetened drinks actually. So usually at diagnosis we will ask them to really cut down, but yeah, they are being good at the sugar is controlled well. We do allow like 10% of the calories to come from the simple carbohydrate, or maybe some amount of like a quail which has got little sugar in it, not as a drink. So we do allow that. Of course, fruits has to be 1 or 2 fruits portion in a diet. So in short, if you see a diabetic diet, it's almost like what every other person
Yes.
eating. Yeah, but the only thing you need some discipline into having the amount that you're eating and also the type of carbohydrate you're taking.
Mm.
So it's
So
not very difficult if you put that in
Yeah.
perspective.
does that throw the keto diet out the window then?
Keto diet, if you are really full blown diabetes, your sugar level are not controlled, I will say no for the keto diet, because the keto diet comes with like 10-20% calories, even maybe maximum of 30%. So if their sugar levels are low, going hyper and hypo, that is not a good diet for them. But pre-diabetic, they're trying to reduce weight, but
Mm.
under some supervision from the healthcare professional, maybe a doctor or dietitian, with close monitoring, then that is possible actually. But as a free hand, any other people on the street, as a diabetic patient, you shouldn't try the keto diet.
All right. Dr. Zanaria, we have a question from Sophia who's asking, is there a huge difference in the type of treatment you get if you're diagnosed with diabetes at a later stage?
Right. So if you're diagnosed at a later stage, it would imply usually that your levels of glucose are moderate to high, and this would
Mm.
be usually in the teens, and sometimes surprisingly, you get people coming in with sugars in the 20s.
Wow.
So that is really high. And that would then implicate that you really need more medications. It would be more oral medications, and even possibly you might be, you know, asked to actually start insulin straight away. Yeah? So insulin is usually reserved for type 2 diabetes later on, unlike type 1 diabetes where you are on insulin straight away. So you need more medications, definitely. And the other thing is you probably have developed complications without realizing. Yeah, you've been harboring that high glucose over some years. You've developed some eye changes, which you can't, you maybe don't realize, but once the doctor checks your behind your eyes, there's changes, there's leakage, there's a bit of bleeding. You may have developed protein in your urine. You may have started to get some numbness in the feet, which reflects nerve damage. And you may or may not also have some cardiovascular problems. So there then is a more complex situation. You don't only deal with the sugars, to get it into the best possible way so that the complications don't progress. Often that patient also has a bit of blood pressure, a bit of cholesterol. So you can just imagine what we call a polypharmacy. The amount of drugs you may need. You may need 3 or 4 drugs for your diabetes. You may need 2 drugs for your blood pressure. So I don't want to scare you, but all
It's a
this can
meal. It
it can
become
be
a meal.
yeah. So as an adult, you actually go for your screening. You be aware of your glucose if you have a high risk in the family. You know your blood pressure. You're not having a high cholesterol, so you can actually you know try to actually prevent a lot of things from going full blown. Yeah. So
Yeah,
that's it.
you don't want that, you buy one free five kind of deal.
Yeah.
That's the kind of deal we don't want.
Exactly.
I know we're Malaysians, we like our bargains, but not that type. So
No.
then
No.
let's wrap up and sort of look at projecting ahead. We started this conversation talking about there's a real possibility you can achieve some sort of reversal of your diabetes and of your blood glucose back to normal levels. So, what does living with diabetes look like, actually, Dr. Zanaria?
Uh-huh. Yeah, so the tagline is always you want to live well with diabetes, so you want a good quality of life, a good quality of you can actually do what another person without diabetes can do. And you can achieve that if your diabetes is diagnosed early, whether you need medications or whether it's early enough that you can work with your care team to go without medications. And you can not allow the glucose to progress so much so that you don't even have to have complications of diabetes. Or if you do have it, because you're controlling it well, it doesn't progress to the stage that you lose your vision, or you need to go on to dialysis, or you need your toe amputated, or you have a heart attack or stroke. So you can have diabetes. Let's just have controlled diabetes, mild diabetes, a possibility of reversing diabetes. So that would be the best thing if you need diabetes, but you
And then
don't need diabetes.
you can have
Yeah,
more free time, Dr. Zanaria, and not deal with so many
good
patients.
quality of life. Yeah, I just wanted to mention that the rate of pre-diabetes we have in Malaysia is a quarter, like 25%, of adults. So having that good lifestyle, hopefully we don't, definitely progress that 25% of the population into frank diabetes in the coming years. So that is really important. Yeah.
And I've left you for the last, Magis, because if we're talking about living with diabetes, again, what people are so terrified of and tend to think is that, I'm the one who can't go for makan-makan with my friends during festivities. We've addressed, yes, you can still eat carbs, but really looking 10, 20 years down the road, for you as a dietitian, from that perspective, what does living with diabetes look like?
I think not at all that you can't enjoy yourself and be in the family and also the social environment. As I mentioned earlier, being a diabetic, your diet is similar to what other people are taking, but it has to be a little bit more conscious of the amount that you are taking. And I think in Malaysia itself, the choices of food is plenty actually. Is you are the one that you're going to choose the food. And I think in terms of diabetes, compared to any other disease, I feel that diabetic should be the more easily controllable because the diet type is not as strict as when you already become a renal failure patient. So that will be even stricter. So I think being a diabetes is much easier to control. I think you can eat with your family, you can eat your friends, you can have your festival food, enjoy yourself, but always caution that my amount is done at certain level. Okay, then they'll be able to enjoy every bit of the events and also the food that they are having. So, in short, that it's not very difficult to control a diabetic diet, but it has to be persistent every meal, every day, and throughout your life. I think that should be the takeaway message actually. You enjoy yourself throughout.
That you enjoy yourself throughout. That's right.
Yeah.
We do have a diabetes diary for all of you watching that you can download. And in that diary, we actually prepared a sort of a food diary. It's something that helps you keep track of when and what you eat, and whether there are certain moods that are triggering you to eat certain things, triggering you to snack. And we hope that it will help you just to be more mindful in terms of your snacking habits, especially, and perhaps that will help you, like what Magis said, just to have it in the back of your mind that you can enjoy, but just know what exactly and how much you're enjoying. So do download that diabetes diary from the link that's provided in the comments, and by downloading it, you'll be in the running for our lucky draw. Thank you so much, Magis and Dr. Zanariah, for joining us and sharing your insights with us today.
Yeah, our pleasure.
Thank you so much.
Thank you.
And for the rest of you, do stay on. We have a bonus for you. It's a Kahoot quiz. So as I said, by downloading the diabetes diary, which is in the link in the comments, you are in the running for our lucky draw. But on top of that, we have a Kahoot quiz for you to win some extra prizes. So if you can go to kahoot.it on your browser right now, that's KAHOOT.it. And when you enter that site, you'll be asked to key in a PIN code. Today's PIN code is 848242. And then I repeat, that's 848242. And when you enter, you'll be asked to put in your email address. So do make sure it's a valid address, and enter the name that you'd like to use for this quiz. The fastest person to answer all 3 quiz questions correctly will win a touch and go e-wallet reload pin worth 20 ringgit courtesy of AIA Vitality, as well as a BFM collapsible mug for you to drink your non-sugary drinks in, since we're talking about diabetes today. So let's have a look at whether people are logging in, and we'll give you a bit more time to log in. I'll just repeat that PIN code again, 848242. If you go to kahoot.it, the PIN code is 848242, and do put in a valid email address to ensure that we can contact you if you are the winner. Now we've got our contestants coming in right now. We'll just give them a little bit more time. We've got someone named Coffee, which is very interesting. Make sure you have your coffee with less sugar. All right, just a reminder, the PIN code is 848242 at kahoot.it. And you'll be in the running to win a touch and go e-wallet reload pin worth 20 ringgit, courtesy of AIA Vitality, and a BFM collapsible mug. Just a few more people coming in, but I think we will be ready to start the quiz right now. So, are you ready? Let's get to our first question. Now, diabetes is a disease where your levels of what are too high? Is it your levels of cholesterol, adrenaline, or blood glucose? Which of these levels are considered too high when you have diabetes? Cholesterol, adrenaline, or blood glucose? And let's look at the answers. It's blood glucose, and most of you have got it right. And we'll move on to our next question now. It's a true or false question. Uncontrolled diabetes can lead to nerve damage and blindness, something that Dr. Zanariah definitely addressed just now. Is it true or false that uncontrolled diabetes will lead to nerve damage and blindness? These are the complications of diabetes. Is it true or false? And time's up. Let's see. Almost all of you got it right. It is true that uncontrolled diabetes does lead to nerve damage and blindness, and that's why we've been talking about keeping it under control. The last question, insulin is produced by this organ in the body. Is it the pancreas, the heart, the kidneys, or the gallbladder? So which of the options is correct? Which organ produces insulin? Is it the pancreas, the heart, the kidneys, or the gallbladder? And the answer is the pancreas, which most of you got right as well. So let's look at who is the winner of this round. In third place, we have 142i. In second place, we have yellow, but we're looking at who's in the first place, and that's Wagner Lu. Wagner Lu, you got all the answers correct at the fastest time. Congratulations. Please contact our BFM's events team with your full name and contact details to redeem your prize. Do use the email address that you registered on Kahoot earlier. You can get our events team's email in the comments section. For the rest of you, again, a reminder to join our lucky draw. Download the Diabetes Diary from the link, and you'll be in the running to win a Samsung Galaxy Fit 2, courtesy of AIA Vitality. Join us next month for our final webinar of the series. Is happening on the 26th of November. That's a Friday as well. At the same time, 12 noon, we'll be discussing the challenges that children today face when it comes to learning, especially after these 2 very difficult years of online schooling for children, educators, and parents alike. And there will be another lucky draw during that webinar, and one grand prize that we are all targeting, the Samsung Galaxy Watch Active 2 worth 999 ringgit, courtesy of AIA Vitality. Thank you to our presenting sponsor, AIA Berhad, for this webinar and the entire series, of course. Now, for all of you watching, please give us some feedback. We'd love to hear from you and how we can improve to meet your expectations. You can submit the form in our comments section. We'll see you next month at the final webinar.